So good day to all. Today we are going to learn something about the development of the respiratory system. Again, before we enter into the topic, everyone should know that the respiratory system, the whole, is being divided into upper respiratory system and the lower respiratory system, where the upper respiratory system is still the larynx, that is the nasal cavities and all the pharynx there. And from larynx down till the divisions of alveoli, it is the lower respiratory system. And the diseases are very much different for both the systems. And a little more, again, a revision for the bronchial tree, what has been done many a times. So the trachea, that will be dividing into the primary bronchus, and the area where the trachea is dividing is called as carina and is at the level of the sternal angle. And this primary bronchus enters into the lung for its further divisions into the secondary bronchi, which in turn divides into tertiary bronchi or the segmental bronchi, which will be supplying a particular part of the segment of the lung, which is called as bronchopulmonary segments. So the further divisions of this tertiary bronchi will be giving rise to the terminal bronchi, and those terminal bronchi will be dividing into bronchioles. So till the bronchi level, there is this cartilage that is present in rings for trachea and the primary bronchus, and from secondary bronchus they are arranged as irregular plates. From bronchioles down the divisions there is no cartilage. So from the terminal bronchi, there is formation of bronchioles, and remember there is always the division is in twos, and the bronchioles will be dividing into further generations till the terminal bronchiole. The terminal bronchiole divides and gives rise to the respiratory bronchiole, which has the outpocketings of the alveoli. This is where you can see. So from the respiratory bronchioles down, it is the respiratory part of the lung. Till the terminal bronchiole, from trachea to the terminal bronchiole, it is the conducting system. From the respiratory bronchiole to the alveoli, it is the respiratory system or the respiratory part of the lung. Whereas this respiratory bronchiole will be dividing into alveolar ducts and that into alveolar sacs, which has plenty number of alveoli ranging to about 300 million. So we all know how the nose is being formed during the development of phase. So these are the nasal placodes where they have a depression called a nasal pit, and which has medial and lateral nasal processes, and these medial nasal process will fuse and the lateral nasal process will fuse with the developing maxillary process. And because of the developing maxillary process medially, which is being fused to the lateral process, there is elevation of the bridge of the nose, which is the feature for the humans. So that's how the bridge of the nose has been formed, and these are the external nares that are formed with the fusion of the maxillary process below the nasal placode, forming the upper lip. So that's how is a very overview of the nasal nose that is being developed. So now let us see the development of respiratory system. By the end of third week or beginning of the fourth week, laryngotracheal groove appears in the ventral wall of the pharynx, caudal to the fourth arch, approximately between the sixth arch, and by the end of the fourth week, this laryngotracheal groove that has been formed will be developing into the laryngotracheal diverticulum, which is surrounded by the splanchnic mesoderm. And this respiratory diverticulum formation is dependent upon very important factors. So the appearance and the localization of the respiratory diverticulum are dependent upon increase in the retinoic acid in the adjacent mesoderm. This increased retinoic acid will increase the receptors for TBX4 factor transcription in gut tube at the site of the diverticulum. So the retinoic acid is very important to be present in the mesoderm, which will upgrade the TBX4 factor, which is responsible for the site of the respiratory diverticulum on the ventral aspect of the developing foregut, that is the esophagus there. And many other genes also are responsible, like Hox genes, fibroblast growth factor 10, SOX genes, SHH genes. All these, they induce the formation of diverticulum and its growth and differentiation into the lungs. The SOX genes, SOX genes, that is 2 and 9 to be more appropriate, are found at the tips of the branching bronchioles in coordination with the retinoic acid that is present in the mesoderm surrounding, will be able to influence the branching of the bronchi into its number of divisions. And this branching of the bud is dependent also on epithelial and mesenchymal interreactions. That is what the mesenchyme has the retinoic acid and the epithelium has this TBX4 and SOX genes, where the interrelation between these two factors is very much necessary for the branching pattern of these respiratory bud or the lung bud that has been developed. And this WNT gene signaling also is very important, where from epithelium, this signaling regulates mesenchymal proliferation of the blood vessel formation in lungs also. So as in when the bronchial tree is being dividing into 23 generations, the pulmonary artery also is dividing along with the branching pattern of the bronchial tree. How is it dividing? How are the vessels being formed? We all know by now that the vasculature anywhere in the body is formed by the vasculogenesis that happens in the mesenchyme, that will be forming into the blood islands, which further organize themselves to form into the vessels. So the vasculogenesis, which is followed by angiogenesis, that is what is the vessel formation. So even that happens simultaneously along with the branching pattern of the bronchial tree within the mesoderm. And SHH gene, that is the hedgehog gene, this modulates the fibroblast growth factor 10, which in turn controls the branching of the bronchial buds. And then coming to the epithelium, which is developed from the endoderm of the developing pharynx, that will give rise to the epithelium of larynx, trachea, bronchi, and lung, whole of the epithelium of the respiratory tract, which also will alter in its cell population as and when the branching pattern goes down the division of its number. And the cartilages, muscles, and the connective tissue surrounding these bronchial tree is derived from the splanchnic mesoderm that is surrounding the foregut. So the development of respiratory system is not complete until just before birth, because the maturation of the alveoli happen just before birth. So the cells within the alveoli also secrete the surfactant just before few weeks of the birth. Without the presence of surfactant, the alveoli will not be able to function to the fullest. Basically, the air exchange, the gaseous exchange, will be hampered if there is no proper production of the surfactant. That is the reason the premature babies always are associated with difficulties with insufficient surfactant. So by the end of 6th month, the alveolar cells type 2 will be start secreting the surfactant which lines the interior of the alveoli. So by the end of 6th month or the beginning of the 7th month, if the baby is delivered, then they may be viable because of the presence of a little bit of surfactant and supplementing with the corticosteroids as we have discussed in the previous lesson. So, and with the intensive care unit properly functioning, the viability of the child can be maintained, but still the child may have the respiratory distress. So to have the overview what happens in the development from 4th week onwards, because at the 4th week only the tracheoesophageal groove is formed, which will be forming into the diverticulum. So on week 4, the tracheoesophageal groove forms on the floor of the foregut, and week 5, right and left lung buds push into pericardio-peritoneal canals. Week 6, there is descent of heart and lungs into thorax because there is descent of this septum transversum on which these things rest. And pleuroperitoneal canals are closed, forming the pleural cavity. And week 7, there is enlargement of the liver that stops the descent of the heart and lungs, forming a proper thoracic cavity. And in month 3 to 6, the lungs appear glandular, and end of 6th month, alveolar cells type 2 appear and begin to secrete the surfactant, which is the most important factor for the viability. And in month 7, the respiratory bronchioles proliferate and end in alveolar ducts and sacs. So before the 7th month, there is no proper formation of the alveoli also in its proper number. That is the reason the viability also is decreased if the baby is born before the 7th month. In the late fetal months to about 8 years of life, there's a marked increase in the number and size of the capillaries and the alveoli to be formed into an adult lung. So now let us see the development of larynx before we go on to the further divisions. So the larynx is developed as a median laryngotracheal groove in the floor of the pharynx. This is what is the floor of the pharynx, you're all aware of by now, between the 6th pharyngeal arches at about the beginning of the 4th week. That will correspond to some time around 26th to 27th day. So this laryngotracheal groove will be developing into the respiratory diverticulum, which extends down, growing into the lung buds. So the cranial aspect of the respiratory diverticulum or the laryngotracheal tube, which is also called as, is going to be formed as larynx. And this cranial end of the respiratory diverticulum is opening into the pharynx by laryngotracheal groove, which forms the inlet of larynx. That is, the larynx communicates through this laryngotracheal groove to the pharynx. And this inlet of the larynx is called as furcula of His. The epithelium of the larynx develops from the endoderm of the developing pharynx, because this larynx has formed as an outgrowth from the floor of the pharynx. So this laryngeal inlet, which is formed in the floor of the pharynx, we said that is going to develop as the respiratory diverticulum. So there is contribution of the neural crest cells to the formation of the larynx, because the cartilage, the muscles of the larynx, and the connective tissue that's surrounding the larynx are developed from the mesoderm of 4th and 6th pharyngeal arches. So the mesenchyme around the laryngeotracheal groove will proliferate rapidly to form the laryngeal cartilages, wherein all the cartilages of the larynx are formed from the mesoderm that is being proliferated around the laryngeal groove, contributed by the 4th and 6th arches. And the epiglottis, which is also a laryngeal cartilage, will be developing from the caudal end of the hypobronchial eminence. So with the growth of the epiglottic swelling and the arytenoid swelling around the laryngeal inlet or the groove, the epiglottic swelling will be applying pressure over the cranial part of the laryngotracheal groove, converting it into a horizontal groove above cranially only. And the arytenoid swellings on the either side of the vertical slit of the laryngotracheal groove also proliferate rapidly towards the developing epiglottis. With the pressure that is being created by the epiglottic swelling cranially and the arytenoid swellings on either side of the laryngotracheal groove will be converting the slit-like laryngotracheal groove into a T-shaped structure through which the larynx is communicating to the pharynx, that is the laryngopharynx part of the pharynx, through laryngeal inlet, which is called as furcula of His. And the thus developed laryngeal inlet is now called as primordial glottis. And the muscles of the larynx are contributed by 4th and 6th pharyngeal arches under the influence of neural crest cells. So most of the intrinsic muscles of the larynx, they are all formed from the mesoderm of 6th arch, and the cricothyroid muscle, which is anterior to the larynx, is formed from 4th arch. So you all know by now that the muscles that are formed by that particular arch also have the nerve supply of that arch nerve only. So most of these intrinsic muscles of the larynx, that is the arytenoids muscle and the thyroarytenoid muscle, the posterior cricothyroid muscles, the lateral cricothyroid muscles, and many of those, they have their nerve supply from the recurrent laryngeal nerve, which is the nerve of sixth arch. The cricothyroid muscle, which is developed from the fourth arch, has its nerve supply from the external laryngeal nerve, which is the nerve of fourth arch and is a branch of superior laryngeal nerve. So the superior laryngeal nerve and the recurrent laryngeal nerves are branches of vagus. So the fourth and sixth arch are related to the vagus nerves. So we can put it in a more proper way as all the muscles of the larynx are supplied by recurrent laryngeal nerve except the cricothyroid, which is supplied by the external laryngeal nerve based on their development from their particular pharyngeal arches. So this is the cricoid cartilage here. This bigger one, what you're seeing is the thyroid cartilage. The epiglottis, this is what is formed from the caudal part of the hypobronchial eminence, and these are the arytenoid cartilages, and cranial to that are the corniculate cartilages. So from the level of cricoid cartilage, the rest of the respiratory tree is called as trachea. So coming to the interior of larynx, the epithelium of larynx originates from the endoderm because it is developing as a diverticulum from the floor of the pharynx. So the epithelium, it is formed from the endoderm of pharynx. And this lining epithelium, it rapidly proliferates and occludes the lumen of the larynx in a temporary phase, where there are plenty number of vacuoles that are formed, and these vacuoles, they coalesce to form a larger vacuole where the vacuolization of the larynx takes place by recanalization that occurs at about 10th week. During this process of recanalization, that is by apoptosis of the cells that are present and the vacuoles formed and coalescing all the vacuoles to form a larger vacuole, there is development of a recess laterally, which is called as laryngeal ventricle. This one. And this laryngeal ventricles are bounded by mucosal folds in front of its opening into the larynx. The cranial fold is called as false vocal folds or the vestibular folds, which form the false vocal cords. The caudal folds are called as true vocal folds or the vocal folds, which form the vocal cords. And thus vocal cords develop a muscle called as vocalis muscle, which is responsible for the speech. So at birth, the larynx is located very high up in the neck between C1 to C4 vertebra. Normally, the adult position of the larynx is between C4 to C7. So at birth, as it is at C1 to C4, that allows the breathing or vocalization and deglutition also to an extent. So by the age of 2 years, there is a rapid growth of the laryngeal cartilages, wherein the larynx descends inferiorly. By the age of 6 years, it reaches to the adult position between C4 and C7 vertebrae. The descent of the larynx is because of the formation of the laryngeal cartilages and separation of the laryngeal cartilages and appearance of them in their anatomical positions. Since these true vocal cords correspond to the junction between the fourth and sixth arches, structures that have developed, so the epithelium of the larynx above the vocal cords is supplied by the nerve of the fourth arch, that is the internal laryngeal nerve, which is a branch of the superior laryngeal nerve. So the superior laryngeal nerve, which is a branch from vagus, is dividing into external laryngeal nerve and internal laryngeal nerve. So the external laryngeal nerve is accompanying the superior thyroid artery, if you remember, and supplies the cricothyroid muscle. This internal laryngeal nerve, it pierces the thyroid membrane and enters to the interior of the larynx, supplying the interior of the larynx above the vocal cords. And the lining epithelium of the larynx below the vocal cords is supplied by the recurrent laryngeal nerve.